guess it was 2 weeks ago on this day, 6:30, at the bar in downtown Morris. Ken ended up collapsing and had a cardiac arrest. And Paul, you were one of the first responders. You want to go ahead and tell us your role that night?
Sure. I was had just come into the city limits of Morris. I heard the Morris Fire Department and EMS get sent to the Carson Taft house for a CPR in progress for an unresponsive person. I was not far away. I think from the time the call came out, it took me less than a minute to get there. I happened to have my AED with me and walked through the bar and to the back grass area, and I observed a female performing CPR on Mr. Iverson. And I used my AED and followed the instructions from it and was able to administer one cycle of a shock, and it worked great and started his heart right back up.
And then how long was the ambulance there?
As soon as the shock was administered, it seemed like simultaneously I looked over my shoulder. Morris Fire Department EMS were there, and they resumed treatment. Did a great job. Transported Mr. Iverson to the hospital quickly, and turned him over to the good hands of Dr. Hera.
That's where you come in, Aria. How did you plan this situation? Your role? Like I guess once you got to the hospital.
We're on call every third weekend for heart attacks. Sudden death is not very common. But what we try to do is reestablish blood flow to the heart as quickly as we can. Most of these events are a heart attack. After the heart attack, they get the electrical abnormality. The electrical abnormality is 6% of patients. It's not very frequent, but it does happen. We basically just take them to the cath lab, try to open up the artery as soon as we can, and try to reestablish blood flow to the heart. All this starts with a little artery that gets irritable, clot, and stop the blood flow to the heart.
So is this? Oh, go ahead. Sorry.
So we try to reestablish flow, put in a stent, stabilize them. Then we have fancier devices now. We have a catheter that can go inside the body and cool off the body. The problem with cardiac arrest is sometimes you get some brain damage or brain insufficiency for a few minutes, and that can be greatly mitigated by cooling down the body for about 24 to 40 hours. So our role is put them on the cath lab table as quick as we can, open up the arteries as quick as you can, and then cool them. And cool them, sedate them, wait 48 hours, and hopefully they get up, walk around, and go home and go back to work.
That's what happened here. Do you know how long it took from whenever he was at the scene to the hospital that you did all that?
We look at it from the moment they come into the emergency room. Most of the time we can put them on the table within 30 minutes. We've had arteries opened in 16 minutes, I think was our quickest. That was a young gentleman from Coal City. But most of the time it's 30 minutes on the table and 15 minutes to get it open.
And so the more time it takes, the worse the outlook is, or it
In the
depends?
field, when they're down, the longer they're down, the more you can have damage to the brain. The longer you take to open up the artery, the more damage there is to the heart. So you want to try to minimize both of those as much as you can.
And so in this situation, how was Ken's situation?
Paul got to him immediately, which is great. That makes our life a lot easier. And as soon as he was in the emergency room, the physicians made the diagnosis and we put him on the table. I didn't see any delays in him, and then we got the cooling catheter in and cooled him off as quick as we could, and then the rest is just waiting.
Ken, when do you remember, I guess after waking up, were you shocked or surprised, or what was your thoughts just waking up after the?
You know, I have almost zero recollection, not only after the event, but the whole day prior to the event. I've seen a video where I read a poem. I don't remember reading the poem. I don't remember going to the little going away party. I remember almost nothing about the day, which is a little confusing to me. And afterwards is just a blur. I mean, I have vague recollections of of people that were there, Jim Watts, from the CEO at the Y, and many, many people from the YMCA who were absolutely wonderful. They all came as a group and sat there for hours. I remember seeing some of them, then family and friends, but most of it is a blur. They say, somebody was there to see, and I kind of remember tiny little pieces of it, but anything in any amount of detail is maybe it'll come back someday, but for right now, it's very, very funky.
Well, and of course, you two had an important role, but there's also other people. This lady, like you said, the CPR. Yeah, Ken, you want to go ahead and maybe mention some of the other people that had, like I know there's Morris EMS and fire department personnel that also had a role. So I don't want to leave them out of the situation too.
Yeah, I don't know everyone. Katie LeClaire, who's our COO, was there with her boy, and actually that's why I was playing bags with this little boy when I went down. I don't recall playing bags with him. But Katie, I think, was one of the people. Dawn Kuhn, who does, not aerobics, but I think she does yoga for the Y, was there for the other young man that was leaving. So I think she was one of them. And then somebody from the bar that said, it looks like you need a break, jumped in. And I guess, would this all be before you got there?
That was before I got there.
So that would have been, I don't know how long that went on. All I know is somebody did a tap dance on my chest, and I still feel that today when I cough. But that's a pain I'll gladly accept, because I'm sure it was all part of, and somebody did CPR. They just did everything right. The stars were lined up. And Paul is the one that I am blown away with. Here's a young man who had no idea who he was saving. It could have been a total stranger. I don't think it made a bit of difference. On his way home, knowing that if he stops, it's going to extend his day, who knows how many hours, but it didn't seem to make a bit of difference. And to me, he is the superstar. And then coming in right behind Paul is Ari and the staff at the Morris Hospital, and this procedure that he has introduced to Morris. It's my understanding it's not available everywhere. Ari, I don't know. How many places is it available?
We found out about it a few years ago. We went to a conference in Florida. Dr. Anelitis and I put it together. And then Morris Hospital is great. Morris Hospital administration got us the equipment probably within 3 months, which is extremely fast for a hospital administration.
Sure.
Most of the time that takes budgets and a year or two. This worked out great, quickly, and all the nurses were right behind it. We've used it in about 6 patients already, and I don't know that we've had one that wasn't successful. They've all done great.
Yeah, the Morris Hospital was amazing from the beginning to end. For me personally, it was, I must have had, I don't know, 8 or 10 former students who kept coming up to me. The family, we did have a little vote early this morning. It was 5 to 6. You were going to be my former student of the year, Paul, for the family.
I appreciate that.
And it was a close call, but you came out ahead. I won't say who was the dissenting vote of this, but seriously, oh my God, these young people at the Y, and also with the law enforcement. I mean, talk about serve and protect. You certainly epitomize that. But I'm just so grateful that Morris has a place like the Morris Hospital that young people can go and have wonderful careers and stay in their hometowns and raise their families and just stay here for the rest of their lives. Many, many small communities don't have that. You have to leave to have a decent career. So between law enforcement and the hospital, and we have that.
Do you consider yourself a hero, Paul?
Well, I just consider myself being at the right place at the right time. And everyone had a part, from the people that called 911 immediately, to the people that started CPR, to me getting there, administering the AED. Morris Police had 2 officers there that I know, Officer Ader and Sergeant Worden. There's gates that go around the tavern. They were able to use bolt cutters to open the gates to let the emergency personnel in quick. As soon as the AED worked and a heartbeat was detected by the AED, they started breathing for him, got him onto the cot, got him into the ambulance, into the hospital as soon as possible. And, you know, the emergency room staff did great. And then Dr. Hera did his thing, and I guess the end result is sitting to my left.